Okay. So this is the first task key. Calculate the likelihood ratio. So let me see if I can see something. Uh, because I'm in the full screen, I may not be able to see the chat box. Let me see. Dr. Revati, you will keep a watch on the answers?
Yes, sir. Yes, sir.
Okay.
I'll have a look.
Okay, okay. So calculate the likelihood ratio. This is the interleukin 6. So this there was a comparison of IL-6 with CRP. So on this side, these are the true positive or the diseased patients with sepsis. And on this side, they are the patients without sepsis. So as you know, sensitivity is from how much of your test is able to pick up among the diseased patients. Specificity is the negative tests among those who are not diseased. And the positive predictive value is getting a positive test among uh, these are the true positive and false positive. Among all the positives, how much are the true positive? And the negative predictive value is among the true negative, how much are the true negative among all the negative. Okay, so the negative predictive value and the positive predictive value will depend upon the prevalence of the disease or the incidence of the disease also. Now my question is, what is the likelihood ratio? So how do you find that likelihood ratio, and what is likelihood ratio? So the likelihood ratio is getting a positive test in a diseased person versus a non-diseased person. So any answers did we get?
No, sir. The chat box is quite silent. I would request the attenders, the
Okay,
students to please, put in your messages. Even if it's wrong, we're here to learn. So
no
please
issues.
answer.
I have given you a hint. So the likelihood ratio is the positive test in those who are diseased versus those who are non-diseased. So it's actually sensitivity upon 1 minus specificity. So in this case, 45 upon 1 minus 0.96. So it will be almost 100. So when the likelihood ratio is more than 10, this means it's a very good test. So a test with the likelihood ratio of more than 100 is an excellent test for detection of sepsis. So this is regarding interleukin 6. We have limited time, so I move ahead with the next one. This is an easier one. So what is this picture showing? If any answers are there.
No, sir. No answers in the chat box. Just giving a few
This
seconds.
is
Yeah,
this
someone
is
has said
the this is
burst
the
suppression or burst pattern on AEG is what the answers have come.
okay, okay. So this is a cerebral function monitor, I mean AEG, and you see both the upper as well as the lower voltages are suddenly lifted up. So this is the time when the baby is having seizures. When the upper and the lower voltages both get lifted up, the baby is having seizures. In burst suppression pattern, you will have sudden bursts, and then you will have very low voltages. So, but this is a pattern for seizures actually. Okay. What is this figure called? This is called as a forest plot. Very good, very good. I'm getting those answers now.
Yes,
And
sir.
what are the factors that affect the study weight? I mean, there are some studies like this is the weight, okay? Some studies like 32%, 0.7%, 6%. So all these studies will add up to make a weight of 100%. So what individual weight is contributed by? Okay, one is the number of events. So there are two things that affect this. One is the sample size. Bigger the study, that will affect the weight, and also most importantly the number of events. So for example, if I'm comparing NEC in probiotics versus controls, if you have the same number of patients, for example, you have two studies with 100 patients each, the patients with higher events, higher NEC rates will get the uh, higher weightage. Okay, so population or the study number of patients and the number of events, right? Probiotics use reduced NEC rate from 20% to 15% in my unit, for example. What is the number needed to treat? So first you have to find the absolute risk reduction. From 20%, you have reduced to 15%. So what is the absolute risk reduction? ARR 5%. Okay, 5%. Yes, very good, 5%. And the number needed to treat is 1 upon absolute risk reduction. So 100 upon 5, that means 20. Very good, Dr. Hima. So this means I need to give probiotics to 20 babies to prevent one NEC rate. Okay, this is the number needed to treat. Lesser this number, more efficacious your intervention is. This is a baby just born at 28 weeks, had RDS, and the baby is put on nasal CPAP. This is the blood gas. How will you interpret this ABG? Okay, the answer is respiratory acidosis. Someone has written that. Let me see. So you can use this acid base map where you will put the pH. So this is the 7.25 pH and the PCO2 is 65. So this is a CO2 value 65 and the bicarb is 28. So this my arrow is at the point that is matching the pH, PCO2 and bicarb. So this is acute respiratory acidosis. You see this leaf has 6 limbs. Okay, 6 leaflets. They are the pure disorders where you have chronic and acute respiratory acidosis, you have chronic and acute respiratory alkalosis, but you have only metabolic acidosis and metabolic alkalosis. They are not acute or chronic. So 6 limbs are the pure disorders. So when you are in the pink range, you are having a simple disorder. When you are in the white range, you are in a mixed disorder. So this patient is having a simple acute respiratory acidosis. Anion gap. So calculate the anion gap in this patient. The anion gap is the unmeasured anions minus the unmeasured cations. But in real life, you don't do that. You do measured cations minus the measured anions. Because of the electroneutrality principle, they will remain the same. So if I do with the measured ones, sodium plus potassium, this will become 149 minus the measured anions, I mean 110 plus 21. So they will become 131. So 149 minus 131 is equal to 18. 18. Okay. Okay, if you have written 14, I will accept that because you have not added potassium, but because since most of these machines now add potassium, so if we add potassium, it will come as 18. If you don't add potassium, it will come as 14. Both will be acceptable. Now coming to how do you interpret this? If you add all these unmeasured anions, which will be 2 plus 2 plus 2, 6. plus 3 9 plus 16 25. Now I subtract the unmeasured cations, which is 7 out of 25. This will also be equal to 18. So whether you do this way or you do that way, the answer will be the same. But in real life, you cannot measure the unmeasured anions and the unmeasured cations. So you do the reverse. Okay. Now what is the importance of the anion gap is, if you are just losing bicarb, suppose in urine or stool, patient is having bicarb loss because of diarrhea or because of renal tubular acidosis or just because the baby is premature, in that case you can supplement the baby with bicarb. Whereas if you have increased anion gap acidosis because of these anions, because the patient is in shock, for example, due to poor perfusion, in that bicarb supplement will not help. In that you have to treat the cause. Patient is in shock, give fluids or inotropes, antibiotics, whatever is required. So what is the type of inheritance here in A? First generation, all well. Third generation, all well. Only one person, a female, was affected in the second generation. Uh, Sporadic can be anything, no, but this is, of course, you can say, but autosomal recessive pattern can very well present like this. So if you have someone, a newly born baby affected with some problem, then you get the genetic test done. Then you get the tests of the parents also. If the parents are not carriers, then probably it was a sporadic mutation. But if the parents are carriers, then it's likely to be an autosomal recessive. What is this? Amniotic band. And what is this? This one on the scalp, aplasia cutis. Excellent. What is this? You can see this on the palate also. Not discharge. This is something can be seen on the palate also. Abstinence pearls. Yes. And this baby is having what? Facial nerve palsy on the left or the right? Yes. Right facial nerve palsy. Very good. Coming to statistics. Okay. Let me see. In a study begun in 1985, before many of you were born actually, uh, a group of 2000 adults were asked about alcohol consumption. The occurrence of cancer between 2000 and 2010 was studied in this group. So, what is the study design? Uh, this is a retrospective cohort study because everything has happened in the past, but the direction of flow was from alcohol consumption to cancer. So this is a retrospective cohort design where everything has actually happened in the past. Okay. Now find the odds ratio and the relative risk. And what is the difference between the two? So in odds ratio, you start with the disease like oral cancer and find among those with oral cancer how many were tobacco chewers. So out of 50, 40 were tobacco chewers. And similarly, you do the same thing here. Whereas in relative risk, you start with tobacco chewing and see how many of the tobacco chewers have oral cancer. So 40 out of 60. Similarly, no tobacco chewing, 10 out of 90. Although the formula will be the same for odds ratio AD upon C in both the cohort as well as the case control studies, but the principle remains different. Answer is correct. 16 is the odds ratio. And what is the relative risk? Relative risk is the risk in patients who are non-tobacco chewers, this upon risk who are, sorry, in tobacco chewers upon those who are non-tobacco chewers. So if you do the calculation, the answer will come as 6. When the disease is rare, this is hypothetical, so here it is looking common, but when the disease is rare, your odds ratio will be very similar to the relative risk. But if the disease is common, prevalence is high, then the relative risk will be much lower compared to the odds ratio. What is the type of randomization here? We have randomized based on the gender. Males have been separately randomized, females have been separately randomized because sometimes the outcome depends on the gender. For example, if we talk of breast cancer, the males have a poorer prognosis. Okay, so in such a case, we stratify them by sex. This is called as a stratified randomization. Women with cancer and without cancer were contacted and asked if they had history of estrogen use, and they were matched. So what is the study design? Started with, yes, case control. Very good. Diagnosis. Pneumopericardium. Next, you see the intestine, CDH. This is a red rubber catheter, not an ET tube. It's not going beyond. Red rubber catheter is not going down. Esophageal atresia. Whether it's staph or not, this air will tell you. So this is esophageal atresia with tracheoesophageal fistula. Diagnosis very quick. You all see day and night. Pneumothorax. This is what? Tram track appearance on the X-ray abdomen. Yes, this is NEC. So this is pneumatosis intestinalis, stage 2A. Coiling of the feeding tube. Again, esophageal atresia, but no tracheoesophageal fistula. Don't call it as TEF. There is no fistula. This is only EA, esophageal atresia, with abnormal vertebrae. You see the vertebral anomalies are also there. So vector anomaly, very good. So what four possibilities will you consider in a baby who was exclusively breastfed, doing very well for 2 days, and on day 7, poor feeding lethargy, patient is in shock and tachycardia? So heart disease, CAH, sepsis, very good. Study design, no exposure. So observation, the exposure was not assigned by the investigator, it was natural. So you have comparison group, if no descriptive study, if yes analytical, and if the exposure and outcome are at the same time. This is called as what study design? Cross sectional. If the outcome is, we go from the outcome to the exposure, then what is the study design? Case control. Starting from exposure to outcome. Yes, yes, fast. We have 2 minutes left. Cohort. Very good. Mode of ventilation. Patient on spontaneous. This is patient's breaths. This is ventilator breaths. So some of the breaths are synchronized, others are not supported. So this is SIMV. Ultrasound abdomen. This is NEC. Very thin bowel with free fluid. So NEC with impending perforation. Signs that a baby is attached well on the breast. Mouth should be wide open, chin should be touching the breast, upper areola more visible than the lower areola, and what else? Lower lip is everted. Very good. So what is this part of the breast called where the milk gets collected? So the baby sucks on the areola, not on the nipple, so that milk enters the baby's mouth. Baby should not suck on the nipple but on the areola, so that he presses on this structure, which are the lactiferous sinuses. Okay. What is the PA pressure here? If the peak velocity is, suppose for example, 3 meter per second, what is the PA pressure? Pulmonary artery pressure in TR jet. It is 3. So 3 into 3, 9 plus into 4, 36. 4V square plus 5. It will be 41. Diagnosis. So bilateral pneumothorax, you see the tubes. In addition, you see subcutaneous emphysema. Okay, subcutaneous emphysema. So it's 10 o'clock. I will wind up and stop sharing my screen.
Thank you so much, sir. Thank you, Dr. Gaurav and Dr. Pradeep, for spending your valuable time in helping our students learn. Thank you so much.
Thank you so much for inviting. Thank you.
Thank you,
Thank you,
sir.
Dr. Revati. Thank you, sir.
Okay, thank you, Dr. Gaurav. Thank you
Take
so
care.
much.
Thank you, sir. Okay.
Thank
Good
you.
night.
Thank you, sir. Thank you, ma'am.
Take care. Bye.